welcome to Ask Win. I have to remember that, you guys, because Butterflies of Wisdom is now in the sunset, and the reason why I changed my podcast title is because I didn't want it to get stuck in the bottom of the heap. But today I have second-time guest, Dr. John DeWitt, with me, and what he's doing is fascinating stuff. First of all, he's going to give you guys an update as to what he's doing. Second of all, we're going to talk about the power of the brain, which is one of my favorite subjects because, as you guys know probably by now, I have cerebral palsy. And so with love and attention and medical care, because 30 years ago when I got diagnosed, my brain was able to overcome not only cerebral palsy, but a brain bleed at that. My brain actually bled out. And so without the brain bleed, I strongly believe I would have cerebral palsy. And so that's why I would have less severe cerebral palsy than I do. So that's why I bring these fantastic doctors and fantastic scientists on to talk about the brain and its superpowers. Well, enough of me rambling. I'm going to let Dr. John take it away.
Well, hi, Wynn. I am so happy and grateful to be on the show. I am really excited to share my brain-boosting experiences and how I went about the journey to get to this point. I am a doctor of chiropractic in Southern California, and I played professional football for 12 years before that. And I back in 2015, when all the stories about concussions and the movie about concussions came out, I was really concerned for myself and for my friends that had played because I wanted to make sure that we weren't doing something that was irreversible or going to affect us later in life. And I decided to start researching that and see what could be done to help protect the brain and what a concussion actually is. And the fact that you yourself had a brain bleed is very interesting. And like you said, it's really ironic and serendipitous that we happen to connect so that we can talk about these things. I originally thought that a concussion was just that, was that it was a physical contusion to the brain, and it could cause a subdural hematoma or a brain bleed, and that was the only thing you had to worry about. But then I discovered in all my research that it's way more complicated than that. There's a whole metabolic cascade of events that takes place from all the way down to the little mitochondria in the brain cells and in the neurons themselves. And it involves the influx of calcium, the outflux of potassium into the cell. That calcium can actually break down the neuron itself and can cause the damage that leads to the chronic traumatic encephalopathy, or the CTE that they talk about. And I wanted to figure out ways or see if there were ways to protect the brain, because with a helmet, there's nothing on the outside that's necessarily going to stop the risk. I mean, it can lower the risk a little bit of a concussion, but just the way that the brain is associated in the cerebrospinal fluid, and it's surrounded by this tough membranous sac called the dura mater, and then there's the skull outside of that. And so it's kind of suspended in the cerebrospinal fluid. And so if you're just running down the street or something and stop really quickly, the inertia, the brain's going to keep going forward inside your skull. And so with football, you stop really abruptly quite a bit. And so that sloshing around eventually is going to cause damage regardless of if you have a helmet on or not. And there's even, it's ironic because some people even are supporting taking the helmet's off, instead of having more of a helmet, go back to like a little leather helmet or something like that, because then people aren't going to lead with their head so much, and it won't be that much of a trauma, because they're going to just for self-preservation purposes. But anyway, so I decided I wanted to figure out the nutritional aspects on what you could do, plus being a chiropractor, I wanted to see what I could do adjustment-wise, because there's 22 bones in the skull, and it was believed years and years and years and years ago that once those past puberty, the bones fused and they couldn't move anymore. But they actually found out much more recently that those bones, actually the plates of the skull, have suture joints, and the suture joint is kind of like a bridge that has separate sections that have little projections that fit inside of each other so that the bridge can expand and contract without actually breaking, because obviously you don't want the bridge to break. And so that actually makes the skull a lot stronger because it's able to shift instead of crack. And so what people do, one of our protocols when they come into the office is we like to check to see if they've had any kind of head trauma, to see if the bones of the skull have shifted at all, and then you can real gently slide those plates of the skull. They only move about 1 millimeter, so you just real easy, gentle movements to realign those plates of the skull, and that can actually increase the cerebrospinal fluid circulation to that particular part of the brain that's right underneath that section of the skull. So that's the chiropractic aspect, but then with the nutritional aspect, I started looking into coconut oil, with the medium chain triglycerides. There's a lot of great supplements out there, like MCT oil with the Bulletproof Diet. Dave Asprey's thing, he's really great. And that actually is something that if you take coconut oil, it's kind of a fascinating experience. You take it, just like a spoonful or two of coconut oil. It doesn't taste great, but I mean, it's experimentation. In 3 or 4 hours, you actually can feel it hit when it gets to your brain, because it's like your peripheral vision opens up and you can kind of see a little bit better. It's really fascinating, and they've done a lot of research with Alzheimer's on how that can actually help improve brain function, because there is a certain amount of neuroplasticity in the neurons of the brain, and that just means that they're able to regenerate, which back in the day we didn't think that once you had any kind of nerve damage, there was no more restoring it, but there's a certain level of regeneration that can take place. And so that was the coconut oil.
I definitely believe it. I definitely believe it, that there's a certain regeneration of the brain that could take place. I mean, you're talking to a person, you're truly here, that had a brain bleed, that has cerebral palsy, and after medical attention and basically love, they loved on me for several weeks, and I got my brain back to where it should be, despite my cerebral palsy. And fortunately for me, I have moderate cerebral palsy, but my cerebral palsy is getting better, believe it or not. It's getting better, not worse. Hopefully it will stay that way, but I believe that there is regeneration of the brain. Now, are we talking about all helmets or just football helmets?
No, all helmets, because that's ironic too, because there's a large amount of concussions that occur statistically in like equestrian events or lacrosse or any of those kind of sports as well. So just helmets in general, and it also goes to boxing. There's a lot of guys that think that we should all, and it's kind of controversial, but they think we should go back to the smaller gloves in boxing, because when you have those huge gloves on, you feel like you can really just wail on somebody, and that actually ends up causing more damage than if you just had your own, almost like a bare knuckle kind of thing, because you're going to break your hand. So it just kind of causes you to kind of ease up on how much you're hitting the person. But it's really amazing, because the brain itself is up to 60% fat, and so you want to give that organ what it needs. And so not only the coconut oil, but also the omega-3 fatty acids are really important to make sure those connections are established. Plus there's a lot of brain boosting exercises you can do. staying active like you're doing with the podcast, with the books, with all these great things that you're doing, it's always good to try those new things, because that's when you're making those new neuronal connections, and that's going to help your brain to heal even faster because it's continuing to learn, which is really inspiring.
Yes. And
go ahead.
As part of my cerebral palsy journey, I am lucky enough to be a Bionic Woman and walk in an exoskeleton suit, which actually it's not even a suit. It's an exoskeleton, which is improving my gait and improving my brain power. And they say my tone from cerebral palsy has been the lowest it's ever been in my life, which of the 30 years of cerebral palsy, I was extremely happy to hear that. And so I think with the trying new things like Sudoku with the brain, like a crossword puzzle, is great for the improving synapsi of the brain.
Absolutely. And I have a friend of mine that actually lives in England, and her daughter has cerebral palsy, and she's 6 years old, and she comes out to the Laguna Center in up near LA, and they have all kinds of fascinating suits like that are always trying to cause you to get better balance, and they're always testing her balance and trying to improve her coordination and things like that. And it's really one of those things where if you don't use it and use your muscles and engage your brain, then you're going to not be able to use it. So you really have to force yourself to get out there and to get into good programs like that to really help stimulate the growth and the strengthening of the muscles and the muscle tone.
Yeah.
So,
it's not only about the legs and working out, it's about the brain too.
Yep.
When you
Absolutely.
think about it.
Absolutely. And so then once I went over the chiropractic aspect of it, I wanted to see if, like I said, if there were nutritional aspects. And there's things called nootropic herbs, such as ginkgo biloba is one of the most common ones that people recognize. And you've got St. John's wort, you've got Bacopa monnieri, you've got vinpocetine, huperzine, all these fancy schmancy names. And these are herbs, some of them are mosses, that they've used in Ayurvedic medicine that help to boost the circulation to the brain, because one of the things that happens after a concussion is that you decrease the amount of blood that gets to the brain by about 50% for a week to 10 days. And so it's important to get that blood back up to the brain. And so some of the other ones, St. John's wort's good for depression and anxiety, and all of these different things. Phosphatidylserine is something else that I came across that's been actually shown to help improve cognitive function in Alzheimer's patients or any other patients that have a cognitive dysfunction. So all of these things are out there. It's just people aren't really aware of them, and I have made it my job to make people aware of them. And that's why I came out with my book about concussions and CTE, and I'm really hoping to get the message out there and help as many people as I can.
Me too, because concussions and CTE, if you guys don't know what John is talking about when he says CTE, CTE is a result of a concussion, and what it does is, correct me if I'm wrong, John, but what I believe it does is it starts eating away the brain. It starts eating away the brain. And so these football players, these professional skiers or professional boxers, if they get enough concussions, they get CTE, which means holes in the brain, which means, everything going wrong with the brain under the sun because of CTE. So have you personally experienced CTE?
Well, that's one of the scary things is after that movie came out and you see how bad the side effects can be. Anytime I walk into a room and forget why I went in there, or if I forget where I put my car keys, I wonder to myself, oh, is this one of the signs? Is there something wrong? And I know for a fact that I had multiple concussions while I was playing football, and it was one of those things back when I was playing that you just didn't really say anything about it because you didn't realize how serious they were. That you just thought, okay, just shake it off and get back in there, and which is the worst thing you can do. And there was a really upsetting video on YouTube recently of a quarterback that got hit in an NFL game and literally had a seizure right there on the field, but no one recognized it, and they ended up putting him back in the game. I couldn't believe it. And the NFL is actually changing their concussion protocols now because of that, because I guess people didn't know what to do about it. And I couldn't believe it. My wife told me about it, and I looked it up, and it's just disturbing because he got hit, and his arms are up in the air, and his arms are shaking, and you can tell that he doesn't know what's going on. He's all disoriented, and the referee's standing right above him and doesn't know what's going on either. And it's a very, very violent sport, and I know that Americans love it, and it's great, and it's just, there's a lot of things that need to change for it to actually continue, or I really don't know if it's going to be around. And it's not just football, like I said. There's, rugby, there's hockey, there's boxing, there's all these other sports, and it just makes you wonder if eventually, 50 years from now, if any of those contact sports are going to be around anymore.
Well, I snowboard. I am the second adapted snowboarder in the world, and one of Challenge Aspen's requirements, Challenge Aspen is adapted snowboard program who I snowboard with, is you must wear a helmet. And I'm thinking that a ski helmet, even though they make me wear it, doesn't have that much protection if you land on your head. So
right.
anything we can do, not only in the medical industry, but in the helmet industry, to make these helmets just a little bit more protective. I mean, when we're talking about kids with cerebral palsy, we're talking about kids with autism, we're talking about kids with epilepsy who all ski adaptively with Challenge Aspen, and yet they make all the helmets, but when you think about it, a ski helmet doesn't necessarily have all the protections that it should.
Right. And there's some different companies out there that have their ways of helping to protect, add another layer of protection. One of them is called Protect Your Skull, which is a cap kind of thing that you wear underneath the helmet that has some extra cushion and support that helps to disperse the impact of the blow. But that's one of the main things. And the NFL, I know with their football helmets, they're constantly trying to upgrade the technology. But that's one of the reasons that I came up with my supplement Brain Med and Brain Med Omegas, is because the fatty acids can actually strengthen the cell membranes of the neurons, so that can actually almost be like a helmet inside the helmet to protect the brain itself directly. Because that's the only thing that's going to actually help protect the brain itself, is to do the right nutritional things to get the strongest nervous system possible.
Because Blaines a nervous system, and if you screw up the brain, you're nuts. You're down for the count. So,
that's true.
Or are these pills that people can take, or injections, or what is it?
It's just a supplement. It's got all the nootropic herbs in it, the phosphatidylserine, and then the omega-3s to help strengthen the cell membranes. And it's one of the things that I'm really excited about, because it It doesn't have there's no stimulants, there's no caffeine, there's none of that stuff in it, even though that can help increase circulation. But the natural herbs, it's all natural, holistic type medicines or not medicines, but just herbs and mosses and things that can help increase the circulation to the brain. And that's the key for any organ in the body. The more blood you can get to it, the more oxygen you can get to it, the better it's going to function.
Yeah, well, I've quickly discovered that over 30 years, this cerebral palsy, and the more I do for my brain, the better, because the more synopsis firing in the brain, the better. And I hate to get all scientific on you guys, but this is what I have to deal with on a daily basis, so I might as well protect my brain. I might as well do all I can to protect my brain from concussion or CTE, because I don't want my brain to be eaten away. And
right.
Even though I don't play football just scares me watching it on TV. I do snowboard, so I may need to look into getting a safer helmet in the next couple of years there, because I did not realize, I thought it was only in football up until today. I did not realize that CTE could happen to anyone after after a certain amount of concussions. And even though I haven't had a concussion in a long time, I know I got one. Don't ask. I fell down a set of stairs and don't remember what happened. I fell backwards down a set of stairs when I was about 7, and that thought still freaks me out. And
I'm sure.
This is after the Blaine Bleed 2, mind you.
No, geez.
So I think I personally have to be careful of my brain. Well, and also I have a family history now of, and this was recent, of brain aneurysm. So on top of the brain bleed, I have a family history of brain aneurysm, which is always lovely. And
lovely.
what we didn't realize as a family was my mom's brain aneurysm, which finally burst in almost June, end of June, early July of 2010, was laying dormant, and I didn't get tested. My family got tested. None of them have brain aneurysms laying dormant, thank God. But I want to get tested because I want to see what is truly happening with my brain after 30 years of the brain bleed. And I want to see what I can do to improve the brain. So in the next couple months I'm going to get tested, you guys, in 2018 or possibly 2019, and then I'll come back and report the findings, because I want to see if there's ways I can improve the brain, or has my brain gotten stable enough. Now, the moment I say that, the brain never gets stable enough, because we're always learning. And we're always trying to improve mental capacities here. So I think concussions are really important subjects that people don't really talk about. And that's my next question. Why? Why do people not talk about how they can prevent concussions, John? I mean, this is ridiculous that we're putting players back in the game, and we're we fall and hit our heads and then move on.
Right. I think a lot of it is just people don't understand how dangerous it is.
Yeah.
And I also think that certain socioeconomic groups, like for football specifically, that is their only option for their kids to go to college, their kids to potentially, go professional and make money. That's their only way out of the neighborhood, and they just kind of push the risk aside, and they're just like, you know what, I'm willing to take that risk. And the sad thing is too, is lack of education for the coaches, because even earlier with the kids in Little League or Boys Club, that kind of stuff, when they're playing, the coaches most of the time are actually parents of other kids, and they haven't educated themselves on the proper concussion assessments, how to determine if, they've had a concussion, what to do about it, and that ends up being an issue as well. So it's not just that they aren't aware of it, they don't know what to do if something does happen. And that's another reason that I came out with the book, is to kind of help to educate people on how to assess a concussion, the different areas of the brain that are affected, and what you can do, because there's a variety of different symptoms that can take place. So every concussion is different because everybody's brain is different, and it's almost like a fingerprint. And so it just depends on where the impact came from, what area of the brain is affected, and then what is going on in that specific area of the brain in that individual. So it's just a lack of education, like everything, and people just kind of want to kind of put it under the rug there and not really know about it, because that's going to change, there are people out in Tennessee. I have friends of mine out in Tennessee that are concerned because all the parents are starting to pull their kids out of contact sports, and they're worried that, football's not going to be around forever. And I'm not saying that's right or wrong. I just think that's a decision made out of fear, and you're worried about putting your kid at risk, which is understandable, but you need to educate yourself and their coaches so that they can make the most educated decision possible, instead of just being scared about it and saying, okay, we don't want to do this anymore, let's put them in the chess club or something like that.
Yeah. Yeah, because it takes is education, you guys. And as I said, once I do get my brain scanned back after 30 years, I haven't gotten them yet, but I will be, as soon as I have time to set that up, I will be coming back and reporting the findings to you guys, because you guys always seem to ask the weird questions about cerebral palsy, and it's like, I don't have answers, even though I have it. And one of the questions you guys seem to ask me is how I am functioning with cerebral palsy through my brain, and I'm just really careful, but I want to see myself through the scans how I can improve my brain. I know supplementation is one of them, but let's just be careful, you guys, when the spring football season starts up for the kids, and let's just educate ourselves on what we can do to help our kids. That's my PSA with John on the phone, because I want these kids to be safe and happy. I don't want concussions. I personally don't want concussions for myself, but I want the next generation to be safe and happy. So when football season starts up, we need to educate ourselves. Now, John, where can people find your book, and how can people get a hold of you?
They can find my book. It's on Amazon, and you can just go to, it's called Head Games, Concussions, and CTE. Where do we go from here? I also have a webinar called concussionclass.com, where I talk for about an hour about concussion assessment and and different brain boosting tools you can do, different little things games you can play, et cetera, to help boost your brain function. That's at concussionclass.com. And my supplement is at mybrainmed.com. And I can be reached via email at support@mybrainmed.com.
So you are all over the place, but go look up the book, you guys. Go look up the book. And I don't want to say force it on the coaches or force it on anyone, but just hand them the book and say, read this to help my child out. Because, and I apologize for the fault of myself, but just say, help my child out, because the parent is the number one teacher, and we as teachers in general, and we as parents need to learn what's going on. And
Right.
if the child doesn't complain about it, we don't know.
Right. Absolutely. Well, on a lighter note, since it is 2018, I was wondering what's your proudest achievement from last year?
All my proudest achievement from last year is publishing another book, and I'm always working on books, and so I managed to publish 2 books last year, and I plan on writing 13 books and publishing them all. Thank you very much.
Wow.
This year, so I plan to continue my side career of being an author, and I plan to try and continue my full-time career of being a teacher, although I'm slowly but surely figuring that out, not anytime soon to be a full-time author, but I want one of my books to hit the New York Times bestseller list, but that's another whole thing in itself. And so I'll just keep plugging along and get those books on Amazon, and maybe someone would notice.
Absolutely. That is really inspiring, and I'm sure the listeners really appreciate that. And I know that I'm going to have my friend whose daughter, I know she's only 6, but I know that she would be very inspired to know that there's people out there that are doing what you're doing and doing more than most people, and she doesn't have to feel like there's anything negative about what she's going through. She can do whatever she wants.
No, exactly. And the problem with cerebral palsy is when you first get diagnosed with it, now the diagnoses are better than they were when I was diagnosed, but it's still a tough challenge. And the problem with cerebral palsy is they either send you to a support group or they either send you down to Google. My poor mom, back in '87, didn't have Google. She had the support groups. She chose not to use them, but my poor mom didn't have Google, and so I think if I was diagnosed now, the testing they can do in the womb for cerebral palsy is amazing. And for any disability now, I know that they can test Down syndrome. I know that they can test cerebral palsy and test to see if the child has cerebral palsy, because what I've come to quickly discover is you can develop cerebral palsy in the womb. It doesn't have to be a traumatic birth injury. You can actually develop it in the womb, and I didn't discover that one until December. So, and I am working on the kids' book, you guys, that should be starting in February, so I need to now work with the kids more than the adults in my writing. But that being said, you just have to be careful with the brain and how you want to use it.
Mhm. Absolutely.
And so I appreciate John's time. I know it's early out where he is. I know he's got to get to work on fixing people and fixing people's brains because that's what he does. And so I appreciate John's time, and I hope you guys learn from John about concussions and CTE, and I definitely appreciate John's time this morning, and I hope you guys enjoyed another fabulous episode of Ask Lynn. This is actually the third maiden voyage of it, and Ask Lynn is going to be more successful, so I hope that Butterflies of Wisdom, because it won't be stuck in the bottom of the heap alphabet-wise, it will be the first podcast you see. So let's share this episode out and give it to people that need it and make the Ask Lynn community bigger and stronger, and let's advocate for concussions and advocate for CTE. Thanks to you guys.